Phase 2 now, Obamacare, and no more health care, at least for now. At this moment, you cannot buy health insurance through the government exchanges. Even if you wanted to buy health insurance policy through the exchanges, you can't. Not through Obamacare, not for the next 7 months. Meantime, people are losing their plans because of Obamacare. So what are these folks supposed to do? Meantime, employers in Hawaii right now, thousands of them, are watching their premiums increase because of Obamacare.
HMSA customers could see a possible rate hike of 12.8%. The Honolulu Star Advertiser reports the association cited costs related to the Affordable Care Act. The proposed hike would affect most of the 77,000 small business workers covered under HMSA. If approved by the state, health insurance premiums would go up for about 8,100 employers renewing health plans July 1st.
Meantime, in Oklahoma, an affordable alternative to the so-called Affordable Care Act, patients can simply pay for health care directly. It's cheaper, it's simpler, and in some cases, it's better care.
Louis Dollarhide is having a hernia repair surgery. Value is particularly important to Louis because he doesn't have medical insurance.
We all are going to need health care. How many people do I want to pay in between me receiving that health care and the people that actually deliver the health care? The system that they use here, there's nobody in between you and the people that deliver the health care.
Now, the latest numbers released by the Rand Corporation come to a simple conclusion. Very few previously uninsured have signed up for Obamacare. Not even close to the 7.1 million. It's more like 1.4 million. So all this for that? Joining me now from our bureau in Washington, D.C., President of the Market Institute, Charles Sauer. Charlie, let's talk about real quick the Rand Corporation numbers before we get to the alternatives to Obamacare. It looks like maybe a third of that 7.1 million number that Obama and company have been touting is the actual number of uninsured who have gotten health care.
Yeah, I mean, this is an interesting number, but I'll say it's actually primarily interesting because we really just don't have that much information on Obamacare at all. The fact that only 1.4 million of the uninsured have signed up is devastating to a lot of people when you consider how much money has been spent to sign up those 1.4 million. But really, we don't know what that number means because they're signing up in a broken system to start with. As the employees in Hawaii are seeing, insurance costs are skyrocketing. In the individual market last quarter, prices went up 11%. In the small group market, they went up 11%. In the individual market, 12%. And that's just an average. In some states, in Delaware, it went up 100%. In California, I think it was 58%. We're seeing prices skyrocket in healthcare. So if that 1.4 million, let's just say that that was 14 million, and the supporters of the bill were excited about this number, we would know that it's still unsustainable. So even at 1.4 million being a failure, when we move out to the future, that number has to keep even decreasing lower than that. So this is a real failure for the Obama administration.
Yeah, rates are going up, and whatever happened to that promise from President Obama saying, hey, most people are going to see their rates go down $2,500 a year. That simply ain't happening. But let's move on. There's been a survey among insurance brokers. I want to hear about that.
Yeah, so I mean, the insurance brokers, they're seeing the prices skyrocket in healthcare. So as I said, the small group market, and that's small employers, that is your mom and pop shop that is providing insurance to their employees. They saw their insurance increase 11% on average last quarter, and the individuals saw it increase 100%. This is something that's just unsustainable. And then when we go back to the exchanges and see that only 25% of the people signing up for the exchanges are youth, when everybody believes that we need 40% of the youth to sign up for the exchanges, or the exchange model to have 40% young and healthy people to actually maintain a level cost. This is just something that they can't keep. The costs are going to continue to skyrocket.
Yeah, it's not sustainable. And when I talk to young people, they say, hey, go ahead and find me and find me, and not necessarily in that order. In other words, they're going to take the hit from the IRS if the IRS has a mechanism to collect that fine. And we don't even know that they do. But let's talk about now the alternatives. We've talked about on this program before the health sharing ministries. I really like that one. But we also just saw one in Oklahoma that seems very reasonable.
Well, the one in Oklahoma is Dr. Keith Smith. He posts his prices online, and people come down from Canada to actually use them. Uninsured people from across the country. Others stay in place and use Dr. Smith's prices to actually negotiate lower rates for themselves. He is really changing the market in the Oklahoma and Texas region and slowly pushing across the country. But I mean, there's other ways too. Sean Parnell recently wrote a book, The Self-Pay Patient, and that book is actually a guidebook for how to opt out of the Obama system, how to use cash, how to join the health sharing ministries, and even how to get negotiated prices on drugs. I used it a couple of weeks back with my wife.
And it works, I assume.
It works. It's amazing.
Well, one of the things I've noticed about, for example, this operation in Oklahoma is they're very upfront about their pricing. And that is, you're going to come in and you're going to pay X amount, and that's it. As opposed to the healthcare system that we have in place now, when you go into a hospital and you're paying all these fees and all these pricings that you don't even know exactly what you're paying for.
So when I first met Dr. Smith, he actually was carrying with him a full-page ad that had just run in the local newspaper. And the full-page ad was from the local hospital, and they had listed prices. And about half of the prices actually matched Dr. Smith's exactly. The only difference was theirs was an all-inclusive. Dr. Smith's price is all-inclusive. But there's actually another group, last group that I'll mention, but it's interesting because there's a movement across the country to push this free market system, and it's pricinghealthcare.com. But you can actually go in and type in your name and address and what you're looking for, a shoulder surgery, a knee surgery, and they will list the facilities around you and the insurance price, the cash price, and also the list price. So they're adding that level of transparency that you're talking about. But this is a movement that really needs to go from these two islands and come together and spread across the country. But I think this is the future of healthcare.
Yeah, I think it's part of the equation for a free market to solution to the problem that exists in this country regarding healthcare, not Obamacare. Charlie, thanks. Coming up next, the Obama administration and killing Americans overseas without due process as the Daily Ledger continues. Stand by. The doors